Hey everyone, it's Crystal here in the AFE Training Center, and today I have the beautiful Steph in my chair, and we are going to do some experimenting with body smooth threads for her. So we're actually going to be placing them kind of around her umbilicus area, lower belly, and then above her knees. So obviously she's a young patient, but these areas just kind of bother her a little bit. She says, especially when she wears dresses and things like that, she doesn't like the way her knees look. That just kind of has like extra loose skin above her knee. Same thing with her lower belly. So we're going to use smooth threads to stimulate that collagen and elastin and really tighten up some of that loose, lax tissue that bothers her. So this will be her first treatment. Obviously she has numbing on right now. We're just using a topical BLT cream. And then we're going to go ahead and get started. So this will be her first treatment. I would expect that we'll need at least 4 to 6 weeks apart, possibly more. We'll just kind of monitor her as we go, taking photos every time she comes in just to kind of see, and we will go from there. So stay tuned. Okay, so as you can see here, I am starting to just kind of mark out exactly where I want to go. Obviously, when the patient is laying down, the skin kind of falls flat, so it's hard to see exactly where that loose, lax tissue is. So you could see I was kind of like grabbing the skin and bunching it up to see where those lines kind of occur when she stands so that I know exactly where I want to place the thread. So I basically just use the markings as like a map of where I'm wanting to go, not necessarily like trying to place them exactly where the marker is or anything like that. It's just to ensure that I am covering the area that she wants treated. So I topically numbed her for about 10 to 15 minutes with a BLT cream and wiped that off, made sure she was good and clean. I use HIPAA cleanse and then alcohol as well before treating patients with smooth threads, and then marked her up. And you can see I'm trying to avoid the marker as best as possible just to not go through it for sterility reasons and things like that. For this particular patient, I am using the V-Soft 29 by 40 screw or twisted threads, just to ensure I'm getting as much collagen as possible. So the twisted threads are still a mono smooth thread, but it's just twisted around the needle, which acts a little bit like, it looks basically like a screw, and it encourages the collagen to stimulate a little bit more because it requires more length of the thread to kind of wrap it around the needle to get to the 40 millimeters than just the mono thread that's just a single thread on the needle. So I'm using these to get as much collagen stimulation as possible. You can see that I'm placing them in a crosshatch fashion because this will ensure that she gets really good coverage of the entire area. So depending on how long the thread is, will kind of let you know where you want to place the thread. So you can see I kind of have like 3 sections across the top of her knee, and each section I'm actually placing 10 threads. So 5 horizontally, 5 vertically to kind of crosshatch and create that almost like fishnet pattern or scaffolding under the skin. So once I placed all of them, you can see that you want to twist them 360 degrees just to ensure that the thread actually slips off the needle. And then I also do this because it causes micro trauma to the area, which helps to kind of catapult that collagen stimulation. So you could see I am pulling the skin really nice and taut. Doing this just helps the needle pop in and the thread just advance really nicely. It really helps to ensure that it just glides in. Sometimes you have to push on the hub of the needle, push down on it, bend the needle just a little bit to keep it in that superficial plane. We still are in the subdermal space, but we're on the more superficial end of that space. So you can see this area is a little tricky because the kneecap, obviously, it's starting to curve. So keeping it in the correct plane can be a little tricky, but this patient did an amazing job. She actually said she could barely feel it. She was just sitting there playing on her phone the entire time. So she was a trooper. She did a really good job tolerating this procedure. She said it wasn't bad at all. So again, just pulling the skin nice and tight, going in about 5 to 10 degrees. Once I broke through the tissue, you can see it just kind of glides. The twisted threads do require a little extra oomph to get all the way to the hub. So you can see I'm pushing it, meet a little resistance there, and then like a little extra push to make sure that I'm going all the way to the hub of the needle. This ensures that when I twist and remove, the thread will actually stay under the skin and stay where I want it to instead of coming out. And you can see I also put some pressure over the distal ends of the needles. Again, just an extra little tip to ensure that the thread stays in place. So this knee is getting 30 smooth threads, which I know seems like a lot, but I'm trying to give her the biggest bang for her buck here, and stimulate as much collagen as possible. Also, this is a pretty wide area, and because I am cross-hatching, it's just requiring more threads than just placing them straight across. So I'm doing a total of 30 threads. I'm going to repeat the same thing on the other side and do a total of 30 threads. And then she will get this treatment done at least 2 more times. So I've already scheduled her out for her next one, which was in the next 4 to 6 weeks. And then 4 to 6 weeks from then, we will repeat the treatment. And then after that, I'll probably see her back again at 4 to 6 weeks and just kind of assess and see where we are. So some patients do really well with 3 treatments only, and then we'll just kind of maintain the collagen by repeating this series maybe once a year for her. If she still wants it to be a little bit more tightened up, then we will just repeat the process until she's happy. So it's kind of the beauty of smooth threads. We're never really worried about placing too many or harming the patient or anything like that. They're very natural. It's just a dissolvable surgical suture, and it's producing her own collagen and elastin. So it's a very natural approach to treating patients. I think that's why a lot of patients really enjoy them. They're also very safe. So again, most patients don't ever really have any kind of crazy reactions to smooth threads or anything like this. No kind of allergic reactions, nothing like that. And I'm never worried about any kind of vascular event. So yes, this is considered a solid filler, but it is completely different from a dermal filler, because it's just a thread. So we're not worried about getting into a vessel or causing any kind of vascular occlusion or vascular compression, which is amazing. It's kind of just like a breath of fresh air while you are placing these, because it just makes you feel a little bit better that you can just place these and not run into any major issues. The worst thing that could happen is a bad bruise or swelling, which typically will go away within a few days. So I think that also is kind of a sigh of relief for most patients as well. Especially if someone has never had filler before, this is kind of like a good starting point for them, just to kind of warm them up to the idea of it. Because it's a little bit safer. So we are now just doing the other knee, and I'm doing the same exact thing. So 3 sections of 10 threads each, which are cross-hatched. So 5 vertically, 5 horizontally. And you can see really pulling the skin taut is helping me get it in there really nicely. So don't be afraid to stretch the skin. Use both of your hands to ensure that the thread slips in easily. I also find that it's also a little less painful or less uncomfortable for the patient, because the quicker you can just slide it in and get it over with, the less the patient is going to feel it. So, but again, she is an awesome patient, so she's doing a very good job. So that's 2 sections down. Now we're on to the third. So again, just placing them in the subdermal space, a little bit more superficial, but still in the subdermal space, and placing 5 horizontally and 5 vertically. Ideally for body threads, I do normally like to use the 27 gauge by 50 millimeter twisted threads, because they're a little bit longer and a little bit thicker, so that you have a little more stability as you're placing them in the tissue. But unfortunately, we ran out of those, so I'm using the 2940s for now, and then I did order the 2750s for her next treatment. But regardless, any threads that you have will work. I just always try to pick the best ones for the particular area that I'm treating to give the patient the best result. So looks like we have a couple more left. So you can see not really much bleeding either. You can almost, like, if you look at her opposite knee, you can see those little like raised areas of where the needle went in. That's completely normal. Those typically go away within 20 or 30 minutes. Some patients' skin just kind of reacts that way to the initial poke. So that's completely normal. So now we're going to twist all of these, take them out, and then clean her up, and she is good to go. So we will see her back in 4 to 6 weeks for her next treatment. Thank you so much for watching, everybody.